Good afternoon, everyone. Thank you so much for joining us. I am going to give it just a minute here as everybody comes in out of the waiting room and gets into the actual webinar. But we thank you so much for joining us for the first of our 4-part series for our frontline staff. Just some education that we're bringing to you as part of our Critical Access Hospital Quality Improvement Program. My name is Sheila Dolbo. I am one of the quality improvement managers at Texas Hospital Association, and I partner with the State Office of Rural Health on our FLEX program for critical access hospitals, which is what helps support this education for you. This program, like I said, is funded through that program. This is a federally funded grant program that assists our critical access hospitals, specifically focusing on some quality improvement measures that are specific to the critical access hospital and looking to improve the quality of patient care and reduce patient harms. This webinar series, each one of these webinars are accredited for 1 continuing nursing education credit. And what we will do at the completion of the 4-part series, we will send out an email link that has the evaluation. And once you complete the evaluation, you will get your CNE certificate. If you are non-nursing, you will still get a certificate to show that you attended the webinar and you participated. If you are participating as a group, for instance, if you're sitting in your conference room and there are several of you around the table watching this webinar together, we don't know who's all sitting in front of the computer to watch. So please go in and register yourself individually, because we use that list to send out the link for the evaluation. And if you do not register on your own, if you're watching it together or you use someone else's login, we would not be able to know that. And so then you may miss out on the opportunity to get the free CNE. And we also, if you log in and listen via a phone number, we do not have any way to link that to you as well. So please make sure that if you're listening as a group, that everybody has individually registered, and that way you will also get the link to the webinar or the evaluation, just some learning objectives for today. We are talking about patient-centered care and the importance of that in our healthcare settings. This does apply to everyone. This is not simply for nursing. I know we give a CNE to our nursing staff, but patient-centered care applies to everybody inside the hospital, because we all play a part in our healthcare environment and the delivery of patient care. And that goes from our registration staff, medical billing and coding, our housekeeping, our facilities and maintenance, all the way to all of the disciplines that take care of patients along the way or provide some sort of service within the hospital. So we are looking at patient-centered care. We'll look at what that is, what it looks like, some of the key principles, and how you can incorporate some strategies into what you do to help deliver patient-centered care. If you have any questions along the way, please feel free to put those in the chat box. I have my colleagues monitoring that, so they'll be able to let me know that you've asked a question, and we'll keep up with those as we go along. Now let's get started into what we're talking about today. I want you to think about your concept. What does it mean to you when someone says patient-centered care? And if you have an idea of that, please feel free to type that in the chat box now so we can see who may know and who may not know. So what is your idea of patient-centered care? And I'll give everybody just a minute to put something in the chat box.
Patient has a voice. So,
Absolutely.
Patient is fully involved in decision making. I like this one. Red carpet care for each and every patient.
Oh, I like that.
Yeah.
Absolutely.
When the patient is an active participant verbally with their care, and holistic care that puts the patient at the center of a multidisciplinary team.
I love the last one, talking about holistic care, because sometimes we forget about the whole patient and everything that brings them to their current situation. And so we have to remember that. Patient-centered care means absolutely seeing the patient as a person. And sometimes I think we lose a little bit of that human component. And we're so focused on their disease process or whatever is going on with the patient at the time that we kind of forget part of the humanity in that. We should not be seeing patients as simply a condition or a procedure or a room and bed number. How many times have you heard someone say the gallbladder in room 2 or the patient in bed 320? We should know our patients. We should be able to know their name and understand them as a whole person, because again, it's putting the humanity back into it and seeing them as people, and putting the focus on what matters to them and not necessarily what's the matter. And hopefully you'll understand the difference between the two as we go forward.
Sheila, one more, or two more rather. It's the patient being part of the interdisciplinary team, providing emotional support and empathy. And then it's healthcare approach that focuses on the individual needs, preferences, and the values of patients. It emphasizes respect, open communication, emotional support, involvement of family, coordination of services, and physical comfort. The goal is to involve patients in decision making and improve overall health outcomes and satisfaction. So putting the individual receiving care at the heart of every decision. So really great entries in the chat.
Yeah, it's a great foundation for understanding what patient-centered care is. Now let's look at patient-centered care versus traditional care. And we talk about, and by traditional, I mean kind of where we're at right now and where versus where we need to go with patient care. So traditional patient care, we are focused on tasks. We have orders that are passed down to us, things that we need to do, and we do them. We give medications, we complete procedures. We're very work oriented. And it's kind of that question of what's the matter with the patient versus what matters to them. It's making sure that we take care of our responsibilities. When you have patient-centered care, you really focus on the person. That might be something simple as their dietary preferences, timing of medications, when they wake up and go to bed. Think about patients when they're at home, what their normal habits are. You may have a patient who normally goes to bed at midnight, 1 o'clock in the morning, and then they wake up at 11 o'clock, late morning, almost noon. And so that's when they take their morning medications potentially, because that's their schedule. But what happens when they come into the hospital? We put them on our schedule. So sometimes we forget to look at the person and what really matters to them, being able to stay on the normal routine as much as possible. So what matters to them versus what's the matter with them. Why does all of this matter? Well, when you look at patient-centered care, ideally, we want the best patient outcome that we can have. And when we have good patient-centered care and we involve patients and their families in the decision-making process and everything else, we see better patient outcomes. When we have better patient outcomes, we have a higher patient satisfaction. That means fewer readmissions to our organization because patients will be compliant with the care plan that we give them. They will follow up as they're instructed to do, and they will achieve a greater level of health. And fewer readmissions mean that there's a lower financial impact to our organization because you can be penalized if you have a high rate of readmissions. We see improved teamwork and morale amongst our staff, and that leads to increased staff satisfaction. Ultimately, this leads to greater sustainability of our organization because in the end, our critical access hospitals and those in the rural environment are far more susceptible to things like financial difficulties and closure than our larger hospitals. So when you have better patient outcomes, you have higher patient satisfaction, you have a higher rate of referral, patients who want to come back to your organization and they will recommend your organization to others. That decreases outmigration, where patients would then shop for care outside of your area and go elsewhere. When you have greater teamwork, higher morale, and increased staff satisfaction, you have a lower rate of turnover. That means you have consistency among your staff, and it's just a better environment for everyone. Now, there are core principles to patient-centered care. First of all, we have respect for patient preferences. We have communication and education, and communication is a huge component to everything that we do. We're looking at physical comfort and emotional support, as some have mentioned in the chat box. Family involvement, also mentioned, and continuity and transition of care. So what happens with the patients once they leave to ensure that they're going to have adequate follow-up and they're going to maintain that plan of care once they're outside of your hospital. So our staff roles in patient-centered care, first of all, we have to advocate for our patients. We have to communicate and have effective communication. We have to educate, and we have to partner with them. It isn't so much that our patients come into our organization and we tell them, this is the hospital, I'm your healthcare provider, and this is what you're going to do or what we're going to do. It's a matter of partnering with them so that they're involved in that process and that they have some sort of control and some sense of place in the decision-making process. It is a partnership. Now, effective communication. So many things break down simply because we lack effective communication. And this can be patient to staff. It can be you talking to your children's teachers in school. It can be simply the interaction that you have with your waiter when you're out getting something for dinner. If we lack effective communication skills, then some miscommunication or something that can be misinterpreted can cause that relationship to break down. And so we have to be mindful of effective communication strategies. So there are key principles to effective communication. First of all, active listening. We have to give our full attention without interrupting. Sometimes it's natural to want to interrupt somebody during the process because you may have a question and you want to ask it at that moment, but they may be going somewhere with what they're telling you. It may take them a while to land that plane and get to the end of what they have to say, but there may be really important pieces of information while they're getting there. And if you interrupt them to ask a question or to move on, you may lose some of that information. And so it's really important to just give full attention and not interrupt and let them finish whatever that current thought process is. We have to be mindful of verbal and nonverbal cues that show engagement. Eye contact is so incredibly important. And we have a bad habit of wanting to sit there and type on the computer while someone's talking to us, or be writing down on a piece of paper something where we're not necessarily giving good eye contact or facing the patient. And that does not show a good active listening posture. And also, if you can reflect and summarize to make sure that you understand what they're saying, the same way that we always ask them to reflect and summarize what we tell them. Clarity and simplicity. We've talked a lot in the past about healthcare literacy, and we have to consider what our average reading level of comprehension is across our populations. And we have to be very careful about the language that we use. It needs to be plain language where we avoid a lot of medical terms or long, fancy descriptions of something and some of those acronyms that we have, because normal people are not going to understand those. Even some people at a higher level of education are still not going to understand some of the things that we may say or the terms that we may throw out there. So we have to be very careful and avoid using those things. Breaking our information down into digestible pieces will make it easier for people to understand. How many times have you been given, gone to the doctor's office yourself, or you've been in the hospital and you've been given a whole lot of instructions to go home with all at one time, and then you're asked if you have any questions? And what typically happens? The answer will be, no, I don't have any questions right now, but you've also been overloaded with information and you haven't even had a time to process any of it. By breaking things down into little pieces and giving them the chance to digest it and understand it, it will increase that comprehension and their ability to follow through with whatever it is you've given them for instruction. And confirming our understanding using teach-back method. This is something that we learn along the way across our educational processes. And this does not just apply to nursing, it applies to anybody across the healthcare environment that deals with patients. And when we educate them on what our processes are, it's really important that we have them give that back to us so we know that they understand it. Not so simple of just saying, do you understand the information I gave you? They may just simply say, yes, I do. But without having them regurgitate that and give it back, it's really hard to identify that they actually do have that understanding. Empathy and compassion. We have to acknowledge emotions and concerns. Our patients and family members, for that matter, when they come into the hospital, they may be very stressed. They may be very upset about their conditions. It's okay for them to be that way. We need to show some empathy and some compassion to that, and use as many affirming statements as we can. I understand that this is a very difficult time for you. I understand that you're not feeling well. And being able to just show that compassion to them, that can go a long way to diffusing a little bit of tension if there is some there, because everybody's at a heightened state of emotion. Maintaining that warm tone and open body language. By open body language, consider how you feel when you're talking to your provider and they're standing there with their arms crossed in front of you and maybe not completely facing you, maybe turned to the side, how that feels. That's not an open body posture. And so we have to make sure that we pay attention to our body language because that can also signal something to our patients and their families. We'll talk some about cultural sensitivity. That is very important to be aware of cultural, religious preferences, or even personal values. And we want to make sure that we do our best to accommodate those. We cannot always accommodate them, but we need to at least be aware of and work as best we can with our patients. When we use interpreters and have language barriers, it is very important that we use what I would call an official interpreter. You can use family members, but how do you know if you are not fluent in that language that the patient's family is also relaying the information accurately what you give them? So that's where it's really important that we be very careful as to who we are using as our interpreter and make sure that we're using the most appropriate interpreting services. Make sure that we avoid assumptions about beliefs or preferences because some people may not follow 100% in terms of whatever religion they identify as or a cultural background. They may not completely walk that path. So we need to make sure that we don't necessarily make an assumption and that we're actually asking our patients and getting an idea for what their true beliefs are and what their personal preferences may be. Respect and dignity always involve our patients in the decision-making process. They should absolutely have a say in what their treatment is, what they're happy and comfortable with, and what they may have questions about, and maybe what they're not 100% sure in as far as being accepting of for their treatment plan. So we always need to make sure that we include them in the decision-making process. And this means informed decision-making. They have all of the information, the good and the bad, laid out in front of them, and they can decide for themselves what they want. We need to ask for preferences regarding care and communication, what is best for them, what works best. And maintaining their privacy and confidentiality is really important. Not everybody wants all of their family members to be aware of their conditions or what's happening. So always make sure when you enter a patient's room and there are other people in the room, before you start just talking about things to the patient, that you ask them if it's okay if you discuss whatever it is you need to discuss with everyone else in the room, because their privacy and confidentiality is really important. Going back to those body language and things like that, our nonverbal communication is very important. We have to be mindful of our facial expressions. Sometimes your face is going to say what you're thinking without you even realizing it. So it's very important to be mindful of what you're doing in terms of body language and those nonverbal cues. Again, our gestures and posture, when we have that closed off body posture and avoiding eye contact. Our tone of voice needs to match our message. I can talk really fast and I have to remind myself to slow down a little bit. The same way some people just naturally may talk really loud. And so we have to be mindful of our tone, how we articulate things and how we come across to people, because something that you may see as normal may come across as offensive or insulting to someone else. So it's really important to be aware. And adapt to the patient's comfort level with touch and proximity. Some of us are natural physical touch people. You might be one of those people who likes to hug everyone when you greet them. Some people don't want to be touched as little as possible. And so it's really important to also be mindful of that and what their comfort level is when you approach them. And you need to touch the patient for something, making sure that we're telling them what we're going to do before we actually do it, and not just running in there and grabbing hold of a patient's arm to do something. Think about how you would feel if somebody came at you with a needle to draw blood and they just grabbed your arm and started going to town drawing blood, and you haven't explained it to you and how you might feel about that. So always adapt to whatever their comfort level is. Timeliness and responsiveness. We have to provide information in a timely manner. It is very stressful when you're in the hospital and you've had all sorts of lab work and tests done, and you're waiting for these results, and you're really concerned about either yourself or a loved one, and you want to know what's going on. And if we do not get back with our patients in a timely manner, that only increases that stress level. It increases the tension, and that can create conflict between everyone and put a barrier to our patient care process. Make sure that we answer questions as patiently as possible. Things may seem very obvious to us, but our patients may have difficulty understanding, and they may answer our questions with another question, or ask the same question again when we just got through giving them that answer. So try to be as patient as possible and follow up when appropriate. If you say you're going to come back and check on a patient, make sure that you come back and check on that patient and make sure that they're doing okay after you give a medication or something like that. Absolutely do what it is that you say you're going to do for them. We have to encourage questions and feedback. And that means creating a safe environment for our patients to actually ask those questions. It goes back to the body language, the tone, the facial expressions. If we give off an air that the questions they ask us, we don't have time for that, I have other things to do, I don't have time for these questions, they're going to stop asking them. And that is going to create a barrier to effective communication. It's going to create a barrier to an effective patient care process to where we have an optimal outcome. So make sure that you're creating that safe place for them. And check in frequently. Ask them if they have any concerns about their plan of care so far. Ask them how things are going for them. If there's anything that isn't working, something that could be better for them. Check in and ask those questions as you proceed through the process, and validate their voice and participation in care. That was mentioned early on in the chat box, that the patient has a voice. We need to make sure that we validate their concerns. I can have an opinion on something, and you can have a completely different opinion or interpretation. That does not mean that your interpretation or opinion is invalid. I have to make sure that I am validating their voice and participation. Consistency and honesty. We have to be truthful. Sometimes it's very difficult because we at times have very bad news that we have to deliver. And we never want to, while it's important to encourage patients and be as uplifting as possible in bad situations, we never want to be unrealistic in what the expectations are. So we need to make sure that any goals that we set with our patients are realistic. Pain management is just one of the best examples I can give. You can have a patient come in with multiple traumatic injuries, and getting them to a pain level of 0 is not realistic. So I do not want to set that expectation with my patients. So anything that you do with them, the expectations need to be a realistic expectation. And that way you're not setting yourself up for a little bit of tension with your patients as well. And be consistent in messaging across the care team. That means from the providers to the nursing staff, to radiology, to lab, to housekeeping, anybody who's going to interact with that patient, our messaging needs to be consistent with every aspect of it, from what the expectation is on how often your room is going to be cleaned during the day, or when you can expect that they will be bringing your meals. We need to make sure that that we are consistent. A supportive environment. One of the HCAP's questions talks about cleanliness of the environment, if it's quiet. So we need to make sure that we provide as much privacy in the setting as possible. Minimize those distractions and interruptions when you are dealing with your patients. Now we have cell phones. We carry cell phones with us all the time. And some of you have communication devices inside your hospital that you utilize between staff members when you're talking about different patients, or you can communicate a need with someone else. We need to make sure that we're not dragging those out in front of the patient and using them, and that we are fully committed to the patient we are in front of at the time. Sit down when talking to build rapport. I don't know if you've ever gone through, it goes back to body language, but when you're standing over someone, that is taken as a stance of authority over them. And so sometimes when you're able to sit versus stand over them, that kind of puts you on the same level and makes them feel like an equal. And it may make them more engaging and more participatory in the conversation, and then in the education part as well. Now, active listening, we're talking about communication, but we have to talk about listening, because you cannot have good communication if you can't verbalize back to your patients if you're not actively listening. Again, going back to paying full attention, face the patient and make that eye contact, eliminate those distractions, and show a genuine interest in them, as though you're there to care for them. They're trusting you with their care or their loved one's care. So show that genuine interest. And again, going back to that body language, I say these things multiple times because they're incredibly important, and they help set the stage for the relationship you're going to have with the patient or their family. But nodding occasionally to show that acknowledgement and that open body posture. And then lean in a little bit. That's another body language sign to show attentiveness. Again, don't interrupt. Let them finish their train of thought before you jump in there with any type of question or solution, and avoid making judgments too early. We can use verbal encouragers that help show that we are listening without taking over the entire conversation and driving how it goes. For instance, telling the patient, go on, or that must be difficult, or can you elaborate on that, and getting them to keep going with providing information to you. Reflecting and paraphrasing, again, this shows your understanding of what the patient is telling you, and that way you know you have it correct and you can document correctly, such as it sounds like you're feeling, nauseated. It sounds like you're feeling a little upset because you didn't get your morning medication when you thought it was going to arrive, or something like that. Make sure that you rephrase back to them, and that shows your understanding, the same as you would expect them to teach back to you if the roles were reversed. Open-ended questions are really important. If you simply ask yes or no questions, you may miss out on a lot of information. So getting the patients to elaborate is how we get the most accurate information that we need. So those are your open-ended questions, such as, can you tell me more about that? How has this been affecting you in your daily life? That gives them the opportunity to give you more of a narrative, versus simply saying, do you have pain right now? That's a yes or no question. Again, summarizing, let me make sure I understand everything correctly. You have pain in your right shoulder. It has been going on for 3 days. It started after you went to the gym. That's being able to summarize and give them back the information to make sure you have things accurately. Again, validating those feelings. Telling them it's understandable for you to feel that way, or I can see that you seem very upset. Can you explain that to me, or let me know how you're feeling? Validating them and making sure that they understand we're here to help you. We're not here certainly to make things more difficult or only do things our way. So strategies to engage patients in their decisions, going back to creating that welcoming environment, greet them warmly, know what their name is when you walk in the room, be able to say, hi, Mr. Smith, I'm here to check on you and see how you're doing, and things like that. Know them by their name and put that human component back into it. Sitting at eye level and making that eye contact if you can, if the opportunity is there. And again, using that plain, respectful language that you find that's more understandable to our patients. We have to build trust and rapport with them, taking the time to get to know their values and concerns, understanding their feelings and experience. And I just mentioned trauma-informed care here. We talked about that last year. So hopefully, if you were part of that webinar, you were able to use some of those strategies in the way that you provide care to patients that's trauma-informed. If you weren't, trauma-informed care simply means taking the patient as a whole and understanding their life circumstances and things that have played a part in their development, the way that they look at things, the way that they view things. For instance, you can have somebody who has been a victim of abuse, and maybe they suffer post-traumatic stress from that. Maybe it is a veteran who was involved in a combat situation, and so loud noises impact them in a negative way. And so understanding that and being able to do our best to not have loud noises or things like that around them and understand those reactions, that's trauma-informed care, being able to understand all of the circumstances that have impacted that patient throughout their life cycle that can also impact their ability to take part in their patient care. Being non-judgmental is very important. We have a lot of patients in our communities who may be addicted to substance. They may be drug users. You may have a situation where you have a local prison system, and you may have patients that come into your facility that are actually incarcerated. It does not matter what their walk of life is. It doesn't matter what life path they're on. We have to be non-judgmental. We have to show empathy, and we have to treat all of our patients with the same level of care that we would give to someone's grandma. So you have to make sure, and sometimes that can be difficult, but we have to still make sure that we do that. Use that shared decision making, present all of our reasonable options, the benefits, the risks, the pros and cons, and make sure that the patient actually has a say in what happens. And ask about their goals and preferences, what their lifestyle is like, what they hope to achieve out of the course of care that they are involved in at the time. And collaborate with those decisions and make sure that they fit their values, not just our clinical standard. And make sure that we do not treat patients differently because they may make a decision that we do not necessarily agree with, whether that is to avoid receiving care or they want something when we feel it is unnecessary. We have to make sure that we are respecting their decisions. The best example I can give is coming out of COVID as we were vaccinating patients and or the population, and the way that people were treated because they chose not to be vaccinated, but also the way that people were treated because they did choose to be vaccinated. It is absolutely patient preference, and they should be making educated decisions, and we should be respectful of those decisions, whatever they are. Again, asking those open-ended questions, what matters most to them at that moment? How do they feel about the options that are discussed? What are their concerns? What are they afraid of if they proceed with something? And how can you best get them the answers needed for them to make the most informed decision? Again, using that teach back on your side to make sure that you understand things clearly, but also making sure that they will also give the information back to you with how they plan to take care of themselves once they go home, and actually verbalize that to you, not just say, yes, I can follow up with my primary care, making sure that they absolutely understand how to do that. Any aids that we have available, we have a lot of visual tools. We have brochures. You can download all sorts of resources online. You can print out all kinds of fantastic discharge instructions, but make sure that when you do so, they are very readable and understandable and things like that to your patient population. And give them time to look over it and be able to ask questions. It's a lot of information when you throw everything at them at once. And if you don't give them adequate time to actually make sure they can understand what you gave them, they're not going to have good follow-up once they leave. And keep in mind, going back to being aware of what our average comprehension level is for reading material. It isn't that high. It's maybe about the 8th grade level, if that. And so when we're providing them these instructions, if they're not at that level, you're going to have a lot of people that are not going to understand it and be able to use it. You also need to understand their ability to actually read, because if they can't read and you don't know that, we're giving them a lot of information that is absolutely going to be useless because they can't understand it. Do your best to encourage patient or caregiver involvement, whoever their support system is. It's incredibly important for them to have someone there to assist them, to be able to also be educated in what their plan of care is, as long as the patient is okay with that. But make sure that the patient's voice is still central. We have all taken care of patients in which we have family at the bedside, and we try to talk to the patient about what strategies we feel are necessary, what treatments we feel are important. And then the patient may not be wanting to take part in that. They may have reservation, but you've got family there pushing them, telling them, no, you really need to do this. We have to make sure that the patient voice is absolutely still central, and we're honoring their wishes as long as they are mentally competent. Any self-management tools, empower them with those, that anything that you can provide them. Again, those clear written instructions. If there's any type of apps or logs, some people are very technologically savvy and those things work very well. If you've got diabetic patients and they need to track weight or a food diary or something like that, there are all sorts of fantastic apps out there that they can put on a smartphone or a tablet if they know how to use them, but they're very intuitive and user friendly, and they're great tools to help patients be able to track their success in terms of maybe their diet or following a specific plan, but also be able to track symptoms and progress as they go. So anything like that you research that's useful to patients, offer those. It's very empowering when you can take control over your own situation. Again, respecting those cultural and personal beliefs, and make sure that our care plans can accommodate them on a spiritual, cultural level, and address any social needs that they may have, and use official interpreters when possible. Again, it goes back to utilizing family, making sure that any information relayed to the patient is actually accurate information that you're giving, which is why you have to use a little bit of caution when you're using family. Follow up and reassess. We always have to ask them how our decisions are working out. How are things going for you now? And then we have to be a little bit flexible and adjust our plan where we can. Going back to the beginning when I mentioned the patients who are night people, maybe they work a night shift and so they're awake all night long. Their schedule is completely different than mine, but I'm going to completely put them on my schedule when they come into the hospital. So how can we be flexible and help them maintain as much of their normalcy as we can while they're in our care? So cultural competence, we have to talk about the impact on our patient interactions. This is a huge piece of patient-centered care and improving our health outcomes when we understand and have a great level of cultural competence. First of all, that builds trust and respect, because our patients feel seen and heard. And someone mentioned that in the beginning as being a part of patient-centered care. They absolutely feel like that they are important to you. And their trust will improve in the healthcare team. And when they believe that you respect their background and their belief, they're more apt to listen to instructions. They're more apt to be receptive to the education that we give them. And they're more apt to comply with their follow-up care and improve their overall outcome when they leave your organization. It improves our communication because we can reduce a lot of those misunderstandings that we get from our language barriers or things that are kind of outside what our typical norm would be. They're more encouraged to ask questions. They're also more encouraged and readily intent upon sharing concerns that they may have. Again, I can't stress enough increasing the use of professional interpreters rather than relying on family. It enhances our patient engagement. They're more likely to participate in their decision-making processes. And when they actually have some control and participate in it, they're more likely to follow up with care, especially when it aligns with their value system. Cultural sensitivity increases their confidence in the providers in the healthcare system, and it keeps them coming back to you. And I mean, not that we want patients to be sick and coming into the hospital all the time, but the patients are what keeps our doors open in the end. And so we need to have patients in our hospital when they're in need of care. We want them to come to us and not go somewhere else. It prevents that stereotyping. We have to make sure that we avoid any generalizations or making judgments. Again, going back to simply saying, just because of someone's circumstances, we sort of lump them into one bucket because that's not necessarily applicable. And it encourages personalized care instead of just that one size fits all, because think of it like shopping for clothes, and they always have the one size fits all size, and it really should not even be one size fits most, because it typically doesn't. And we do not want our health care that we provide patients to be that one size fits all, because people are going to fall out of the system, and we're not going to be doing our best job for everybody when we can't tailor it to them and make it more personalized. We minimize our non-adherence and our resistance to our plan of care. And then it allows our providers to make sure that we adapt any recommendations that we may have, or find acceptable alternatives of when something that we need to recommend kind of violates whatever their religious or cultural beliefs are. Again, promotes that patient satisfaction where they feel very understood. You may not have a lot of patients that are Muslim in your neighborhood, but this is a good example because they may have a need to fast during Ramadan if they follow very strictly. And that might lead us to adjust our medication timing or suggest something else that would lead to a better adherence of their plan of care and build that trust. So understanding those things are very, very important. Now, just a couple of case studies and examples to look at to get your thought processes and think critically about what could go wrong in this scenario. First, we have a patient discharged from the hospital after a 4-day stay related to new onset diabetes. And at discharge, they were provided all of those handouts that we have. We printed up some beautiful discharge instructions, and then we just simply asked if they had any questions, and they said no. Well, they came back to the emergency department within 24 hours because they were not able to follow up with their medications and things like that once they actually left the hospital. So as you think through that process, the discharge of a patient, what could have possibly gone wrong in that scenario that led to that patient coming back into your hospital within 24 hours? And just drop that in the chat box if you think of something that might have contributed. Do you think it could have been a communication problem? If they're just given a lot of instructions and asked, do you have any questions? Definitely effective teach back, absolutely. Should have reviewed a dietary. Who knows if that was done, right? Education and understanding. No teach back. Can't read or can't afford their meds. That is so incredibly important. Or knowing how to take their meds. I bring up the reading level all the time because we have very successful people out there who can go on and open businesses and be extremely successful people, but they may not have ever made it out of junior high. That's always a possibility. And so, yes, social determinants of health could absolutely play a factor. You guys are killing it on identifying some of the things that could have been overwhelmed with a new diagnosis and information overload. Absolutely. And no one to assist them. Everybody needs a support system somewhere to be able to assist them. Good job on that one. Now, looking at the flip side, we have a patient being discharged with new onset diabetes. The patient received their detailed education on use of insulin with teach back to confirm their understanding. Education and instructions provided with family at the bedside to assist that are going to assist this patient at home. Their follow-up appointment with their primary care doctor was made before they left the hospital. They were given time. They were given all of their instructions. The nurse was able to go away and then come back prior to the actual discharge and see if they had any questions at the time before they left. And they confirmed once again prior to discharge correct understanding of that insulin use and follow-up care and instructions, so the patient and family feel heard and confident. How do you think that outcome went as opposed to the other? I bet this patient had a greater level of compliance. I bet they also had a greater level of confidence once they went home. Confidence to take care of themselves or have their support system assist in their care. That's absolutely crucial. Definitely improved compliance with new instructions when you take the time. And I know it's hard. We talk about taking time and having time. And I know it's hard in everything that we do because we are so busy. There is so much to do in the patient care environment and all the care that we delivered. And this is at all levels. And I know it might feel like this is only looking at nurses or those at the bedside, but it goes all across the board, from facilities management, when you have repairs that you need to do or things that need to be addressed inside the patient rooms, and being able to have the time to do that and be as least disruptive to patients as possible. Housekeeping, being able to go in and clean when a patient is present in the room versus being able to turn over the rooms when a patient is discharged, so that you can bring in another admission, admitting when you need to get patients checked in, get them registered, and make sure that all their documents are signed. I mean, this is just across the board, making sure that we take the time to talk to our patients and educate them. And talking about admissions, you put a lot of stuff in front of the patients for them to sign, and they're signing documents. Do they actually have the time to sit there and read the document that you're giving them to sign, or are they just signing it and they don't even understand what they just signed? What about going back to those patients who cannot read and they're just signing documents with no understanding of what they're signing? So this is truly across the continuum of care and not just at the bedside. Reflection: take time to think about an opportunity that you provided or you witnessed great patient-centered care, and think about what that looked like to you and what made it the most effective. How did the patients and their families react or engaged in that process, and what was the outcome? How did that change the dynamic and the interaction between the patients and the rest of the team that were taking care of them? How did all of that change? Think about that in terms of what you've seen and what you've witnessed. This is an interdisciplinary collaboration. Several of you mentioned in the very beginning patient-centered care, talking about it being interdisciplinary. Again, this is across the continuum. This is from the time the patient walks into our door to the time that they leave, and how things go once they walk outside of our organization. Healthcare delivery is a team sport. It is not just nursing. It is not just laboratory. It is not just housekeeping. We should not have a whole bunch of silos inside of our hospitals. This is an interdisciplinary team activity, and we need to respect everyone's roles and responsibilities. And that goes from our colleagues inside of our hospital to the patients and their families, because they also have a role to play. And we need to make sure that we're sharing very clear information across the team. Now, create your own action plan. What's one small thing you can do this week to put patients first? And put some things in the chat box. If you can think of one thing that you can do this week that you may not already be doing, what would that be that would take a step to implementing patient-centered care within your organization? How might you improve what you do on a daily basis? Somebody's got to have an idea. We always have ways to improve. Slow down. I like that one. Listen closely. Take extra time to listen. Absolutely. Absolutely. And you have to be intent upon listening to somebody, because think about this too, and consider how you do when you're having a conversation with somebody. Most of the time, somebody can be saying something to us. We are already formulating our response in our mind. So we're not really listening to anything else that they're saying. So try to avoid already formulating your response. Listen to everything. Round on patients and specifically ask open-ended questions. Yes. Patient safety huddles. That is absolutely a fantastic idea. Ensure little things like the timing and medications are happening appropriately. Absolutely. If you tell a patient you're going to be back with medication in an hour, come back with medication in an hour, and make sure that things are happening in a timely manner. Good job on those. Communication is hugely important. So some final tips and takeaways. First, start by evaluating your own mindset and ask yourself those questions. Do I focus on what's the matter with the patient, or do I focus on what matters? Those are two different things. So think about your mindset and how you approach patient care or your job duties, and which is your mindset. And think about your own preferences and how would you want to be treated if you were on the patient end? How would you want your family member to be treated? Because all of us at some point in time have either been a patient ourselves or we've had family members who were patients. So consider how you would want your preferences honored. And then consider the patient preferences that you have and how you can best accommodate those. Engage your leadership and your colleagues to develop an action plan for patient-centered care. Somebody has to start the train moving down the tracks. And who better to do that than those of you on the front lines taking care of the patients, because you're there every day with them. You know what questions and concerns they have, and you already have some ideas on how to make things better. Meet people where they are. Remember that small actions matter, and you all make a difference in everybody that you come in contact with. And so how you interact with them is going to determine what type of difference that is, whether it's positive experience or potentially a negative experience. Now I'll open it up for just a few minutes to see if we have any questions. And if you do, please feel free to drop those into the chat box. We'll give just a few minutes. Just in case, and then I will give you a little schedule of what we've got coming up. Can you please yes, we can send the link to register. Actually, you only have to register one time. It should populate. You should be able to populate on your calendar, and because it is set up in Zoom as a series. So it would just be one-time registration. And then what will happen when you get the evaluation at the end, then you will be able to identify which webinars that you actually attended, and then you would do the evaluation for those particular webinars, and then you would get the CNEs for the webinars that you attended. So it should just be one-time registration, and it should populate all presentations on your calendar for each week.
And just in case, I dropped it in the chat again.
Yes, thank you, Nina. Next week, we will be talking about quality improvement, because again, it absolutely takes the whole village to implement quality improvement and improve the plan of care that we deliver to patients. And you at the very front line have a huge role to play in that. So next week is quality improvement. We hope you will be back and join us for that. On August 12th, we'll be talking about moving to high reliability. That is also going to play a part in quality improvement. And if you're not familiar with high reliability, that is where we basically make the movement happen from the frontline staff up versus things coming from the top down to you, and giving you ownership of your work and what you do and how you facilitate change. And then last, on August 19th, we are going to talk about AI in healthcare, because that seems to be the hot topic right now. And there is so much happening. So we're going to talk a little bit about what's going on with AI, what role it may play in healthcare, and how we can be ready for that in the future. Thank you so much for joining us today. This is my contact information, my email address. If you have any questions at all, please do not hesitate to send me an email. I am happy to answer any questions. If you have something you identify in the future that you would like to have in terms of education, please send me that as well. Or make sure when you get around to doing the evaluation at the completion of this series that you put it there, because we definitely read all of your responses and your input, and that's how we know to bring you what you actually want. So with that, it looks like I might be able to give you back 5 minutes of your day. Again, thank you so much for joining us, and we look forward to seeing all of you next week. Have a great rest of your day.